Hi, I'm here to pick up a prescription.
What was the name for it?
It's under John King.
Okay, can you just confirm your date of birth for me?
Yep, it's January 19th, 1972.
Okay, and would it be alright if I just take a few minutes to ask you a few questions and make sure this prescription is going to work optimally for you?
Sure, sounds good.
Okay, so have you ever used this medication before?
No, it's new to me.
Okay, and do you have any food or medication allergies that you know about?
I have a dairy allergy and a peanut allergy.
Okay, I'll make sure that's on your file. Are you on any other prescription medications right now?
Yeah, two actually. I'm on metformin and simvastatin.
Okay. Do you take any non-prescription medications?
Not regularly. I do sometimes use Advil.
Advil? What do you use that for?
Mostly headaches or kind of muscle pain. That
Okay.
kind of thing.
And do you take any herbal or natural medicines?
No, just a calcium supplement.
Okay, and do you have any current medical conditions or changes to your health that we should know about?
Well, I do have diabetes, and I guess that's why I'm taking those other two drugs.
Okay. So what did the doctor tell you about your hypertension?
Well, not a whole lot. My numbers aren't great. I'm looking at about 142 over 93 right now.
Okay. So the medication that you're getting today is called Ramipril, and it's part of a class of drugs called ACE inhibitors, which work by relaxing your blood vessels, and it causes a little bit of a decrease in blood volume, which will lower your blood pressure and help out with your hypertension.
Okay.
So every day you're going to take one of these pills, just one every day, and it's really important for you to take them consistently for them to work properly. So what time of day do you think would work best for you to take them?
To be honest, I think mornings are probably best.
Mornings? Okay, that's really common. So typically this medication will start to lower your blood pressure within a few hours, but you won't see a noticeable result in the numbers for about 3 to 4 weeks, and you won't feel any different taking these. But taking them consistently will definitely decrease your risk of cardiovascular disease. So when you come in for a refill in 1 month, we can check in and see how they're working for you.
All right, sounds good.
Typically this medication is really well tolerated, but sometimes when you lower your blood pressure, it may cause some side effects. So watch out for fatigue, dizziness, and nausea. These are the most common ones. And if you notice any of these, you should go see your doctor right away.
All right, I could do that.
Okay, and just one last thing. Since you take Advil for your headaches, you might want to consider switching to Tylenol when you get headaches, because when these two are combined, Advil and Ramipril, it reduces the effectiveness of the blood pressure medication. So you're going to be able to switch to Tylenol?
Yeah, I don't think that's a big deal. I mean, they're really, to me, they're the same thing.
Perfect. Do you have any last questions for me?
I don't think so, no. I covered everything.
All right, well, here you go.
Great, thank you.
You're welcome.
Hi, I'm here to pick up a prescription.
All right, and what's your name?
John King.
John King, is this prescription for you?
It is, yeah.
All right, and can you just confirm your date of birth for me?
Yeah, January 19th, 1972.
All right. Have you had any problems since you started taking the Ramipril a month ago?
No, everything's been going pretty smooth.
All right, and it's for your hypertension, right?
Yeah, that's right.
Okay. Do you mind if I just ask you a few questions here, just to make sure this drug's working good for you, and just update your profile?
Sure, yeah, that's fine by me.
All right, so do you have any food or drug allergies?
I actually do have a dairy and peanut allergy.
All right, that's on your file here. Any changes to your prescription medication since you were last in?
No, everything stayed the same. Just my diabetes medication there.
Yeah, the metformin and simvastatin?
That's right, yeah.
Okay. Any over-the-counter medications you take? Anything sold at the front of the store?
Well, not really. I did used to use Advil, but I've switched to Tylenol.
All right, and what were you taking the Tylenol for?
Well, just your standard stuff, really, like headaches, muscle pain, that kind of thing.
Oh, okay, yeah, and nothing too severe though?
No, it's all pretty minor stuff.
Okay, and do you take any herbal medication?
No, I do take like a calcium supplement, but that's about it.
Okay, and have you had any new diagnoses or any changes to your medical conditions?
No, things have been pretty consistent.
Okay. Have you had the opportunity to check your blood pressure since you started taking the Ramipril?
Well, actually, it's funny you mention it. I just checked it out there in at the machine before I came here.
Okay, and what was your reading?
It was 123 over 85.
Okay, those are great numbers. It does sound like it's starting to work well. Have you noticed any side effects since you started taking it?
I don't think so. Things have been going pretty smooth. You know, nothing major to report.
Okay, sometimes people don't notice, or they find these things and they don't realize it's attributed to the drug.
Okay.
Things like dizziness, nausea, even numbness or tingling in the fingers.
Okay, I don't have any of those. I have developed a bit of a cough in the last couple of weeks, but might not be related. I don't know.
Okay, what kind of a cough? What can you tell me about it?
It's kind of like a dry cough, but it's persistent. You know, it just doesn't go away, but it'll get worse.
Okay, are you a smoker?
No, I'm not.
Any fever or cold or flu symptoms?
No, I haven't been sick at all. I just it's just a cough.
Okay, so it does sound like a cough related to your medication. It's relatively common for this drug class called ACE inhibitors to cause a lingering cough. This is because it constricts your bronchioles in your lungs. What time are you usually taking this medication typically?
Usually I take it in the morning first thing with breakfast.
All right, well, how about you try taking it before bed and see if that helps? If it's still persisting and irritating you by your next refill, we can definitely contact your doctor and look at switching you up to another medication. There's plenty out there that won't cause that.
Okay.
And how often do you realize you forgot to take your medication or skip taking it altogether?
Not very often. I'm pretty consistent. I almost never miss a day.
That's great, actually, because with this drug, for it to be most effective, consistency is key. We want to keep your risk of cardiovascular disease as low as possible. And as long as you're taking your doses and your numbers are dropping, that does sound like it's working good for you. Just make sure to keep an eye out for any unusual side effects like that dizziness or upset stomach or anything.
Okay.
But yeah, sounds good. Did you have any last questions for me?
Not really. I think everything's been going good. I'll keep an eye out for that cough like you mentioned, and we'll see what happens next time.
All right, well, if you think of anything, you're totally welcome to give us a call. We're always happy to answer any questions. Otherwise, have a great rest of your day, John.
Thanks, you too.